Good morning, everyone. We'll get started in about 2 minutes. We usually start at about 8:32. Grab yourself some coffee, whatever you might need this morning to get going, and we'll get started at 8:32. Thanks. And while we're waiting for the last to join, just want to remind everyone that per our policy, we are not allowed to enable most of the remote note takers. So the AI note takers, we do have to deny the entry of those. We are able to use Gemini and ChatGPT, but not all of the others. So those do have to be denied. But we do post these recordings, so folks will be able to go back and watch this on our website at garretthealth.org. And I'm going to go ahead and just start pulling up the agenda so we can start at around 8:32 this morning. And give me just a second here. Okay. Can everyone see the agenda? Fantastic. Thanks, everyone. Okay, so it's 8:32. We give everybody a minute to start rolling in. If folks join, we can just catch them up, or they can go back and watch the recording. So welcome to the September Garrett County Child and Adolescent Wellness Work Group. Happy fall, y'all, just in case it's not fall when we come back in October. It's a little chilly out this morning. So just want to remind everyone that we have an open call for our presentation series overview and request for presenters. So what we tried to do here over the last year with this work group is really invite folks to come present different topics that are related to child and adolescent health, or could be related to sort of the totality of family health, particularly if they're newer or innovative services that we want to make sure that folks are aware of, understand the intricacies of how they operate. So that is open. If you are interested in presenting at one of the future meetings, please email myself or Beth Brenneman. Our contact information is available in the meeting invite, and then you can also find it on the garretthealth.org website, as well as all of the recordings under news, Garrett County Child and Adolescent Wellness Work Group, and you can find our contact information, as well as all of the previous recordings going back to when we started this practice, and any attachments for each of those months as well. So before we get things kicked off here, we have some fantastic folks with us this morning from the Garrett County Local Behavioral Health Authority and Local Management Board. I just want to thank Beth Brenneman always for helping coordinate all of our meetings, helping make sure everything logistically gets where it needs to go, helping with our minutes. She just does a fantastic job with so many things. So thank you, Beth. And then I'm going to go ahead and hand it over to our friendly folks at the Garrett County Local Behavioral Health Authority and Garrett County Local Management Board to talk about developed and developing behavioral health resources, asset mapping, and additional resources. They have a fantastic presentation this morning to share with us.
Thanks, John. This is Fred. You didn't tell us who you wanted to talk first, so I will, I guess. Hey, that's cool. So I think everyone probably knows what our office is about, but I believe that's in the PowerPoint that was worked on. I'd like to thank Lindsay, Katie, and Carly for spending a lot of time on that. I'm not sure, there was probably some, I think Sadie and Jillian may have had a little bit to do with that, but primarily it was Carly pulling everything together with the presentation that was done before with the LBHA LMB in a different meeting, and used kind of the same type of template, which was great. And so it's a very general overview. A lot of it includes the asset map that you'll find, or that you'll see today, is focused primarily on the school-based behavioral health and supports. And we are working on expanding that for a full community asset map to allow people to have more of an understanding about what is available in the county, not just with behavioral health, but also the supporting services and agencies that might relate to anything that's related to behavioral health, which includes mental health and substance use disorder treatment services. So I think from this point on, It's going to be a combination of Katie, Carly, and Lindsay. And Sadie, if there's anything school-based that you want to add for the grants that we have through the LBHA, please do that. So I will defer to everyone else in the office.
Good morning. So yep, we're just going to go through this slideshow. So first off, I think that everyone probably knows, but Local Behavioral Health Authority, Local Management Board, Local Care Team, and the Coordinated Community Sports Partnership are all housed in our one department led by Fred Pulse, the champion. The Local Behavioral Health Authority serves as the management entity for publicly funded mental health and substance-related disorders. Sadie works really hard to integrate existing services and expand its currently available services. We assist individuals within the PBHS in receiving medication, transportation to services, housing, and employment. And we work with partner agencies in the county to provide resources for individuals enrolled in PBHS. And I'm going to let Lindsay talk about Local Management Board.
And I'm sitting in the office with Katie, so it's just going to look like Katie's still talking, but Lindsay Broadwater. So the Local Management Board, as Katie mentioned, is also housed within this office. The Local Management Board works under the Governor's Office for Children under their guidance, and they define some result areas with corresponding outcome indicators. Currently, we're working under the enough pillars and result areas that Governor Moore has set. Then the local LMB utilizes some data related to those results and indicators and other local data, like the community health assessment, and they prioritize the results and indicators that they would like to focus on for each fiscal year. And then using that information, they determine some programs and community strategies to fund. So currently, the list of funded strategies are there: the Healthy Families and Learning Beyond the Classroom programs, as well as some other community outreach strategies. And then the Local Care Team falls under the Local Management Board. The LMB serves as the neutral convener for the Local Care Team, which brings together some agencies throughout the county to help families with children who are struggling with, mental health issues or educational issues, emotional struggles, sometimes legal issues, to discuss their goals, the issues that they're facing, and some community-based services that might be able to help them, and even discuss some things outside of community-based services when needed.
All right, that was it for Lindsay's section of our office. So we'll move on to the Coordinated Community Sports Partnership, which we call the Hub because that's a very long name. We serve as a central point of connection. We link students and families to essential behavioral health services. We're really trying to streamline access to care and ensure that students receive support through all of the different partnerships in our county, working with local education agencies, service providers, and other community organizations. By focusing on the streamlined referral system, the needs assessment, and consistent communication, data-driven evaluation, the Hub strives to improve student well-being, enhance family support, and build community capacity for behavioral health. Our overall goal is really to create a healthier and more supportive environment for all. And in the Coordinated Community Sports Partnership, CHRC asked us to do asset mapping whenever we were a pilot hub, which was FY25. Just again, Fred had mentioned it, but this data is specific to our CHRC asset map, and it was current as of November 1st, 2024. And we're currently working on updating this for the new year, but we kind of have to get into school and everything first before we can start getting this mapped out. So for CHRC, we go off of the tier system. Tier 3 is treatment and services and support. Tier 2 is early intervention, and Tier 1 is mental health promotion services. And then we also help with professional development and support for a healthy workforce. So we do a lot of training. We work with the National Center for School Mental Health They do a ton of training, a ton of TA, so they're great to work with. We have 3 service providers that we work with in Garrett County. We have the Center for Behavioral Health, which is housed in the health department, Health Education and Outreach, also housed in the health department, and then Mountain Laurel Medical Center. And Mountain Laurel actually is in the Garrett County hub and the Allegheny County hub, which the LBHA office manages both Garrett and Allegheny hub. Yes, Fred? Oh,
Hey, I just wanted to see if it's okay with you, if people have questions during the PowerPoint presentation, can they ask?
yeah, definitely. If you
Okay,
just
great.
raise your hand or jump in,
Thanks.
I'll stop talking. Okay, so for the tier system, Center for Behavioral Health does tier 3 services, which is generally classifies as like intensive mental health services. So they do a lot of one-on-one. HEO does tier 1 prevention at their Partners After School program. And then Mountain Laurel offers tier 2 and tier 3, so moderate and intensive. And then we're going on to our needs assessment. So this needs assessment, CHRC asked us to use their template that they had created with National Center for School Mental Health. They asked us to consider publicly available data, input from students and families, and then input from the school district using the SHAPE system. So in our district in Garrett County, we have 12 schools. We have 8 Title I schools and 5 community schools. And our current enrollment for this year is 3,405. Last year, when we sent out the needs assessment, we compiled all of the data and we found that these 6 issues were really the major concerns that most families and students identified. So we have mental health, vaping, substance use, lack of resources for mental health, bullying, and then student behavior and disruptions. This is a very pulled together graph of just all of the data we collected. I think the one that we originally had was like 20 pages long, so we really condensed this just to make it a little easier to look at. So I'll just let you guys look at the percentages. It was pretty shocking, the percent of middle school students that said that they have been bullied on school property. And then high school, the highest percentage was rates of students who felt sad or hopeless every day for more than 2 weeks. So that's a pretty significant percentage that we looked at. And I think that's a big reason why, you know, this group and the other groups we're probably a part of all really focus on mental health. Additional needs assessments used by our office is the 2025 to 2027 Community Health Assessment. We use this for the hub. Lindsay uses it in the LMB grants just for GOC. We refer back to the survey results all the time. Access to healthcare is the top of those survey results. And then mental health is actually ranked number 4. And so we actually use that data and refer back to it pretty constantly. One big update that we have from the hub is that Mountain Laurel, as I said before, is in Garrett and Allegheny school systems, and they've actually been able to expand their behavioral health services for students. They removed the requirement for students to use them as their primary care provider, which was such a significant barrier because I think a lot of us know that families don't want to change from their PCPs that they've had for sometimes decades. Sometimes they're just generational. And it really just allows them to access these crucial behavioral health supports just a little bit easier. And then these are some of the links we use all the time. On My Garrett County, we have groups for each part of our department. And then these actually, when this is sent out, each of these pictures has the link that goes to the, oh, you can't see that. That didn't work. But there's the link on it that goes to the provider guide, the resource guide, and then My Garrett County. So if you click on them, it'll take you directly to that link. And I think that's it. Did anyone have anything to add? Sadie, I know I went over the LBHA portion. I didn't know if you wanted anything to add anything or say anything.
No, I think it's pretty well covered, Katie. Thank you for covering that.
Thanks, Sadie. Any
So
questions?
go ahead.
No, Fred, you go ahead.
Well, I mean, if there are any questions, we'll hear the questions first or comments. Okay. Can you all hear me okay? Okay, I can. So I think the question that I have, or that maybe our office has for this committee is, it was picked in the survey to focus on mental health, I think, unless it was behavior, I think it was mental health. And then also access to care, I believe. Is that correct, John? Were those the two, how behavioral
That's
health or
actually
mental?
screen share. So behavioral health, specifically mental health is the primary focus. Hold on
Yeah.
1 second. Let me see if I can take over from Katie here real quick.
And I think the committee identified that plus access to care, if I'm not, or more awareness of resources.
This one was child maltreatment was the second highest ranking.
Okay.
And then resource coordination, enrollment, et cetera, which really is, in many
Yeah.
ways an access to care issue.
And so I think, it would be nice, and Lindsay had a good question, a really nice question for this committee is, what do you think, what's the action that this committee can have or impact this committee can have focusing on any one of these priority areas that were identified in the survey? So for example, for mental health or behavioral health, what can this committee do that's actionable to lead, and what type of change is it that you're looking to see happen as a committee with any of these areas?
I think that's a really excellent point, Fred. And I think that that's where a lot of our discussion was last month and trying to figure out, as a work group, we're not a formal committee. So we're just a work group that reports to the Health Planning Council. But what we ultimately, I think, would like to try to do is try to find a strategy that we can implement on either a population basis or on an individual practice basis, particularly because we do often have several different types of providers that join this work group. So there's kind of two pathways that we could potentially take. With behavioral health in particular, I think it was really valuable that your staff put together this fantastic presentation to really give an overview of what the current supports and planning like as it currently stands is, because I think that a lot of folks might not have been totally aware of all the different supports that were going in with like the tier 1 through tier 3 services, and that basis, particularly as it relates to youth, specifically children and adolescent populations. So I think that there's sort of an open-ended piece there, and it really is up to the work group to try to find that. What we would ideally like to see from the work group is a project sort of from beginning to end that we're able to track, we're able to report, and we're able to sort of utilize that as an example of how we have a multi-sectoral approach within a specific population. So for this particular work group, the demographic is children and adolescents up to age 24. That was determined based on a lot of the different cutoffs for access to care, really, and different services that are available that really do shift after the age of 24. So that really is our target population. And then, the opportunity to have a project sort of run all the way through and have an implementation with the multi-sectoral approach is sort of the second piece of that. So, but I would really love to hear from other folks who are on the call this morning, whether they're staff at the Garrett County Health Department or from other agencies. I think that this is really something that we need to discuss as a work group and figure out, are we choosing areas where we can have an effective strategy, or is it something that's going to be too high of a resource? Is it duplicative of other existing efforts? So with the example of behavioral health, there's already a couple different committees that are engaged in that. Do we want to just support those efforts, or do we want to, potentially look at a different focus area where maybe there isn't as much happening at the moment? So for the example of child maltreatment, we had the really recent EPIAID report that came out, and we realized that there's a lot more work there that could be done, just literally an asset mapping. It's sort of a start with child maltreatment. So I want to kick that back to you all, and Sadie, I see your hands up, so let's start with you.
Okay, I think one of the things that really stands out to me is the one on autism and autism spectrum resources. I know that there are a lot of students that are diagnosed with this, and I know that there are parents that don't know where to turn for resources like this. So for me, I think that would be good, because with the behavioral health stuff, we have other committees and stuff doing that work. Child maltreatment, DSS does a lot with that, but there's not a whole lot out there for autism. So that's the one that really I think is very important, and getting resources out to the parents.
Thank you, Sadie. Yeah, that's really helpful insight. Lorena.
Hey, John. Actually, fantastic presentation. I would completely agree with Sadie. I think some of this is just getting the word out that these resources are available. For example, Mountain Laurel having the co-joint primary care and behavioral health services. I don't know that a lot of people know that. And I think that if we could figure out a way, maybe that's what this committee focuses on, is doing the education and identifying opportunities to get the word out. Might be a good use of the time.
Yes, thank you for that, Lorena. And that actually hits on something that we've previously done as an activity in this work group. So one of the activities that we did several years ago was actually a promotional campaign around adolescent well child checks, because that was driven by our SHIP metrics through the State Health Improvement Plan. We realized that there was a pretty low uptake, specifically around CMS populations. And we developed several different media assets, and then we actually had several different agencies distribute them and sort of do a targeted campaign just to make folks aware of what a child or an adolescent well child check is and why it's beneficial. And it was a pretty short run campaign, and it tied in really nicely to a lot of the work that Shelley did with working with several of the individual practices. So I think that also is a really good point to bring up, is that sometimes these can be, just awareness or really getting to that access to care issue. I think that no matter what we choose, access to care is a really complex issue, because it could mean several different things to different people. And almost every single one of these, really actually all of these, have an access to care issue embedded in them as well. So Karen, let's hear from you.
I totally agree with Sadie. More and more in WIC now, we're seeing more kids diagnosed with autism. And we would love to have a group of resources here to help those parents whose children are newly diagnosed and they do not know where to go to get help for that.
Thank you, Karen. Yes, it's very helpful. So I would like to continue to hear from folks sort of in support of that, if that's where folks think that we need to target our attention. Because the other thing I would like to ask, if someone from the LBHA or LMB could put some information in the chat about some of the other groups that exist for behavioral health, because I do think that there's still, certainly room for us to continue growing in behavioral health with access in particular. But if someone could put a couple of those other meetings in there, so that way we can really look at the issues that don't have attention kind of at the moment. So what I'm really hearing is that there's a lot of need for autism and autism support resources. So let's continue to hear from it. Does anybody else have anything else to add, or any comments on that topic area or any other areas? Yes, Lydia.
One of the things that I think, there's so much with behavioral health and autism that goes together. And having been a parent of both, I think that having I'm not sure what kind of resources are available there for parents to help educate them. Obviously, encouraging willingness to participate is also important. But I think that having something that would involve parents to get the support in their homes, because we can do so much in the schools to help support the child, but if we can get the parents to be on board as well, that's going to be a huge in helping each of the kiddos be able to get through their day.
Yes, thank you, Lydia. Those were also really fantastic comments. And I see Karen's agreeing with you. I can't see all my chat. Thank you, Jillian, for putting a ton of information in there, because I do think it's important, because I know that there are a lot of folks who really are extraordinarily passionate about behavioral health, and I want to make sure that they can continue to, participate in that from that angle if we end up kind of looking at different areas. Any other comments this morning about topic area and focus?
Yeah, John, this is Fred. I think Lydia just made a great point, and that's people that we often overlook in talking about resources or services are the supports for the parents or care providers. And when you talk about access to care, you can have all the services you want to have coming into the home or at the school or other community settings. However, if the parent or care providers do not have the ability to kind of vent and regroup themselves, that becomes a problem when it comes to intervening or implementing interventions at the home or even at the school. And so, Lydia, thanks for mentioning that. And there is a group in Garrett County, well, in the state of Maryland, it's called Maryland Coalition of Families, that do a fantastic job. And I don't know if they're part of this work group. I don't think they are, but their role is to support the care providers, because they have the lived experience of caring for their own children, for other family members during very stressful times, and have learned a lot to be able to kind of have people vent a little bit and offer support. And they do a lot of free events for the family members. So that's another group that we could maybe ask to be part of the presentation in this work group meeting. And then I was in communication with an in-home autism services provider that I think is through Shepherd Pratt, and they are I'm still trying to get them to come up to Garrett County to do a presentation, probably in the Behavioral Health Education Task Force meeting. I think Jillian put that in the chat, I'm not sure. But that will be an option for the school system and care providers to hear more about what's available in the state. Even though it's a downstate program, in the Baltimore area, they're expanding services throughout the state. So that's a positive thing.
Yeah, Fred, thank you for that. And Maryland Coalition of Families has participated. I believe they had a new person come on board within the last year or so that isn't always able to make this call, but they are here on occasion. Okay, yeah. And then, yeah, Verna as well. So I think that there's another person too now. But yeah, we will definitely do some outreach there to those folks and make sure that we can get them engaged, because I think that, across the spectrum, that's a really good point that, they certainly have that touch point in that experience, and they've always been incredibly helpful in this work group in the past. So I think that that's a great idea. So any other comments on priority or focus area before we potentially take sort of a show of hands? True self. No, I don't know anything about that, Lydia.
That's
John,
in
it's
Cumberland.
Karen.
Yes.
So the other one, I think, like as we were mentioning, for parents needing to vent on like autism and tough times in their lives. I'm the mother of a child who was bullied to an extreme point his entire way through elementary school. And it would be excellent if we could focus on helping parents, helping their children who are being bullied, get them through that time. Because I can tell you that Dustin and I felt very alone and did not know what to do for our son. Even though he was getting behavioral health services through here, we were not sure what to do at home to get him to school in the morning.
Thank you, Karen. I really appreciate you sharing that. Oh, yes, Jamie.
I had kind of a similar thing in fifth grade with my daughter, and the problem kind of with it was that she would say that her bully was not being there was nothing we could do. I wrote a report. I did all the paperwork. The principal was aware of it, but like, I mean, to the point of like physical harm being done to her, and she still has to sit in class with this girl, and she still had to be out on the playground so it's knowing that there's something that's being implemented that's like in place and like that they feel safe. And of course, she doesn't want to cause waves. She's very non-confrontational, but like it was daunting listening to her coming home every night, calling the school every day, going in, several times, and there not really being anything aside from eventually she was removed from the classroom, and but only after there were like into things put on the internet about like other kids and like other kids making reports and trying to talk to parents about, if you have something that has happened, then you need to make this report. You have to say something. It's not, one case being documented isn't something that's going to, cause an effect or cause a change. So I think that educating the families and the kids and everybody, and let them know that there are processes in place and that there is help for them getting the word out. Sometimes the kids don't, whenever we go into the schools and we're speaking with children, I know personally when I've been out in the community, I'm an outreach worker, for anybody who isn't aware, at the health department. And she, I'm sorry, whenever I go out and speak to children or youth in the community, and they talk about sensitive topics, things that are bothering them, I ask them, do you know that this resource is out there for you, that you're able to communicate with with somebody? It's confidential. You don't have to, when I get them the resources, they say they didn't know, or they weren't aware that was out there. And a lot of times it's also frustrating because I know that we've been out in the community and talked about these programs. We've put out the information, but they don't retain it a lot of times. So having the guidance counselors and stuff being on board, and we work really great with them. So I think just the whole thing about getting the resources out to people, letting them know that they're there, having them posted or available. That was all.
Thank you so much, both of you. I really appreciate you being able to share those lived experiences that I think are just incredibly impactful and really underscore the need for a couple of different things. And to Shelley's point, she put a really good comment in the chat as well, talking about some of these strategies that could be really good demonstrations that we can then use in other applications and how we sort of do planning across the county and even the region. And I think that, what I'm also hearing here is that, we had a couple of different topics, but a common thread is not just access, but also just understanding access for support. So that might be something that we could potentially explore, is that we might start with autism resources or with bullying resources or whatever that might be, but in sort of this whole family unit, or, the support for the people who support. So Lorraine, I'd love to hear your comments as well.
Yeah, thanks, John. I think that one of the topics that was brought up is an excellent topic, which is cyberbullying. As parents, we don't always know, right, that it's happening. And so by educating the parents on the cues to look for, that might be another resource. But also to Jamie's point, right, a lot of people don't know how to report or what to do. We had similar situations with our oldest daughter, who's now 26, with bullying at school and cyberbullying at the time, which was more Facebook related. But now there's a million different avenues that this could come through. So, perhaps an education campaign for the parents around, what cyberbullying means, cues to look for, as well as, the avenues that you go to report, if your child is being bullied. Because you feel like you're alone. And you also don't want to future ostracize your child.
Yeah, thank you, Lorena. That is also very helpful information. And I think that you're also touching on another point there that is really important, is that sometimes just having the right resource kit and the way that we actually disseminate that and distribute it can be really impactful and meaningful. It certainly isn't, a panacea that's going to magically solve a lot of these issues, but I do think that it's a really nice value added service that we could explore as sort of this work group and look at some of these different projects and coordinating some of these educational campaigns across that. Anyone else have any comments this morning?
John, did you see the email that Melissa shared?
No, I did not. Hold on a minute.
It's,
Is it in the chat or an email?
I think it's in an email itself.
Are you talking about the mobile?
No,
It's the one about the autism listening
Okay.
session.
No, Melissa, do you want to talk about that?
I don't. I was trying to see if I could share it in the chat, but I don't. I just wanted to share the resource. I don't know that I'm the best to speak to it. It's a MDH autism related needs stakeholder group, and they're having a listening session. Feel free to forward the email. Let me see. It says Wandering and Elopement virtual autism listening session will be held September 15th, 6 to 8 p.m. Let me see if I click on, it's a Zoom meeting. So if you want to forward that email, feel free to do that.
Yes, absolutely. We'll make sure that that's available. And thank you so much for sharing that. And I also, I saw that Lydia put a link in the chat as well. And I think that that's a really important point, is that I've already found out about 2 different things that I didn't know. So I certainly think that there's some room just in asset mapping here, as we sort of share some ideas and some stories and different things this morning. So I want to go ahead and put something forward here, since it's about 9:07. So it seems like what we've heard over the last 2 or 3 months here is that there's already a lot of different groups that are meeting, that are addressing mental health specifically for children and youth, but even in a broader context. So I'd like to kind of put something forward as a potential strategy change, which is totally in line with what we do in planning, right? So we went through the process, we identified an issue, we did some asset mapping, and we realized that, that there is a pretty significant amount of resources and individuals that are already working on strategies, many of which are also funded, which, we all know is a pretty important part of this. So I would like to potentially put something forward here, and I'd like to get a show of hands. So locate that little hand button down at the bottom of your screen. And I would like to propose that we explore the idea of putting together resource kits with potentially something more at the end of those, additional service options, but resource kits starting with autism and maybe potentially bullying as well. And maybe we approach that as a work group project, since we've already done really great asset mapping here just in a couple of minutes this morning. That's also something we can do asynchronously. I would like to put that forward as a potential strategy change. Since we've done the asset mapping, we realize that, potentially there are already a lot of resources. What does everyone think? Do we want to potentially change our strategy to putting together resource kits and then figuring out how we do the education around that and the dissemination, with potentially more if needed when we get to the end of each of those different processes? Put your hand up if you think that's a good idea. Counting hands. Okay, so we go off a simple majority, so we're there. So you can go ahead and put your hands down, and thank you all for participating in that. I didn't warn everyone that there would be a participation element this morning. So let's go ahead and look at that. I will prepare some resources for our next meeting, potentially maybe some templates or some other ideas that we can explore. It's looking at this as sort of an asset mapping project and health education component. So I will go ahead and get those prepared. And then that way we can kind of have that ready for our next meeting. As a reminder, there's also an opportunity for the presentation series if anyone wants to present at the next meeting as well. and we'll take it from there. And I'm going to go ahead and transition us over to agency updates. And I just want to thank everyone for really engaging and participating this morning as we've had all these conversations. I just truly from the heart appreciate the folks that have shared their lived experiences, because I think that really further underscores the need that really exists for some of these services and the supporting activities around them. So agency updates or community updates, they don't even have to be from an agency. I'm going to open it up. Anyone have anything this morning? Yes, Karen.
Mute. Sorry, I had to unmute myself. So a couple agency updates. I just want to remind everybody, it's been on social media, but as of July 1st, we are only offering organic in tofu, baby cereal, baby food, and the fruit and vegetable money, mainly because of increase in food costs. And they have launched our client portal, and you can now get on MD Think and apply for WIC and create an appointment.
Fantastic. Fantastic about the appointment. Unfortunate about the other parts. So thank you for sharing that, Karen. Any other updates this morning? Sadie, yes.
Yes, I'm currently working on something for adolescents, 16 to 17-year-olds, and young adults, 18 to 25. We're going to be having a coffee and combos event. I tried to reach out to Black Hawk Coffee House, but I couldn't get them to call me back. I'm going to check with the theater and potentially have a coffee house with this age group, having like a focus group type setting to talk about stigma related to mental health and addiction. And then after that event, doing a pre-post with them, and then doing an activity like a painting activity or something. So I'm looking forward to that. And I think it's going to be nice to get the input from the youth in the community for that.
That's wonderful, Sadie. Thank you for sharing that. Any other updates this morning?
I have one.
Yes, Shelley.
So we have our final Harvest Hub distribution this Friday, and that will be advertised on Go Garrett County Plus. That's our Healthy Together grant and our Maryland Department of Health CSA grant, where we buy from local farmers and put together a curated meal. And people can pick up those ingredients. So that will be this Friday. And then at the 360 Access Hub, we are coordinating with our partners an open house, like a ribbon cutting ceremony. And I believe that is October 24th at 3:30. So everyone will be invited, and there's more to come on details of the 360 Access at Health Planning Council later this month.
Thank you so much, Shelley. Any other updates before I give my little spiel at the end? Okay, so just two things I want to remind people of that are currently happening. So there's a lot of really great programs happening in health education. James can certainly chime in if he has anything, any better information to add here for sure. But the one thing that I really wanted to draw attention to is the Narcan pickup events. We did recently have to issue an overdose alert in Garrett County. So I just really want to continue to push that as a resource now that we're getting into our clinic season. We have to change our health department communication strategy a little bit for flu clinics and rabies vaccines. So I just want to make sure that that information continues to stay out there, because, you know, we did issue that overdose alert, and that is an important resource, certainly that is available for the county. And then the other thing that Shelley might also have something to add, I did notice that all of the ads have started running already for the Rural Health Transformation Program. So that is a CMS directive that came through with some of the recent bills and funding and all kinds of different changes. But that is also something that the health department will be engaged in. So I just wanted to let folks know to also keep an eye out for that, because we will be posting some announcements as we get a few additional details on that. There is a pretty quick turnaround. So anything else to add to that, either of you or any other topics? Okay, well, hearing none, we're going to actually close up a little early today. So I want to thank everybody for coming. This has been a fantastic group this morning. We had a ton of folks join us and great participation. Kristen also put another great comment in the chat that there is an enough meeting in Kitzmiller this evening from 6 to 8. If you were part of that community, that is also posted on the health department website, and you can find the additional details for that. And I think that those have been really fantastic. Shelley and Kristen have done an amazing job coordinating those with Fred's office, with Lindsay, and several other folks. So exciting things happening in Garrett County, and I hope you all have a great day. And I just want to thank you all for taking time out to really focus on the work group here this morning for child and adolescent population. So thank you all and have a great day. And also, please remember to get off the meeting so the recording closes. Thanks.